Let's move on and let's get you some updates regarding COVID, and that are coming in from the southern state of Karnataka, where the upward trend in COVID cases continue. In fact, as per the Karnataka Health Commissioner Randeep Dev, the peak in the COVID cases in Bengaluru will come in the first week of February. In fact, cases in district of Karnataka other than Bengaluru will also peak at that time. In fact, this is the claim that has been made by Karnataka Health Commissioner. And remember, just to tell you what is the situation like when it comes to COVID in Karnataka, the state is still reporting high number of COVID cases. And in fact, in the last 24 hours, around 40,000 cases have been reported across the state of Karnataka, and out of this, over 24,000 cases have been reported from the capital city of Bengaluru alone. In fact, speaking to Mirror Now, Karnataka Health Commissioner also said that irrespective of when cases peak in the state of Karnataka, their focus remains on ensuring that hospitals do not get crowded. Listen into this conversation.
We had always expected that the districts will start showing higher number of cases once Bangalore more or less peaks. Normally it has been in the first two waves also that initially Bangalore leads in terms of the number of cases. The districts kind of lag and then they catch up, especially the districts surrounding Bangalore. If you see Hassan, Kodagu, Mysore, normally the districts which have a lot of travel of people between Bangalore and these districts. So that is on expected trends. In terms of testing, you need to appreciate that ICMR has also recently amended its stand on the testing to make testing far more focused, to ensure that testing is targeted at ILI-SARI patients, it's targeted at primary high-risk contacts, comorbid, above 60 years, just to see that we are doing targeted testing. A large part of the unnecessary asymptomatic broad-scale testing is sought to be reduced.
We are expecting the peak to be by January and Feb first week.
Well, the projections did indicate that February first week is when we would see the state and Bangalore peaking, with a lag of maybe a week or two for the other districts to follow. We are more or less seeing that trend. Probably the city of Bangalore in the last week of January or February should peak. But more than the peak, what is more important for us is to ensure that the CAB, testing, cluster control, all these things we follow meticulously. Ensure that there is proper triaging and no crowding at the hospitals, because it boils down to that finally.